Okay, welcome everybody. So we don't have a big agenda, and I'd like to get right down to business. This hot topic of whether to call for a mask mandate by the Board of Health or not. That's sort of the question that's in front of us. And I would like to ask for Megan to give us some orientation towards the recent numbers, and Jennifer, I'm sure you'll probably want to chime in as well. So go ahead, Megan.
Hi. So for this month alone, August 1st to today, the 25th, we've had 42 cases. Last year in 2020, we only had 12 cases for the entire month of August. So we're significantly up this year. Of those patients, we have 10 current positives. That's still in their infectious period. 5 of those positives are fully vaccinated. Since July 1st, we've had 47 cases. Out of those 47 cases, 20 have been fully vaccinated. I've had 5 hospitalized, and that's an overnight hospital stay. 3 of those hospitalized patients have been fully vaccinated. Total confirmed cases are 874 since the start of the pandemic. Confirmed and probable are 926. None of those include the suspect cases. Those are just lab reported, confirmed and probable. Antigen tests count as a probable, even though it's 95% that they're positive. Any other numbers? That we've had 1 death in August. Any other?
Was that a vaccinated or unvaccinated?
It was a vaccinated.
Vaccinated, okay. And good, thank you. Yeah, Kelly.
Meg,
Oh, sorry.
I just had a quick question. I'm sorry, you were breaking up a little bit on my end here. You said something about the number that were hospitalized. I didn't catch that
I have
number.
2
I'm sorry.
current hospitalized patients now. Total hospitalized since July 1st have been 5. 3 of those have been vaccinated. And those are, and by hospitalized, I mean overnight stay, not an ER visit.
Yeah. Great. Thank you.
Go on. Go on. Sorry. Okay. Okay. And Jennifer, did you have you usually send a report about the numbers of positives, the percent positives and all that?
So last week we put out on our weekly newsletter the most up-to-date according to the state. So that's what I have because the state only puts out weekly data. There are other websites that kind of get everything together, but if we're going to go by state data, that's what I have. Basically, Massachusetts and Franklin County are both at high risk. Franklin County's confirmed case count as of last Friday was 94 in the last 14 days. The percent positivity in Greenfield is 1.44%. In Franklin County, it's 1.71. And the rate of transmission throughout the state is 2.7. The rate of vaccination has basically been stable according to that last report. It didn't increase or decrease. In Franklin County, basically 61% of Franklin County residents are vaccinated. 69 have had 1 dose, but fully vaccinated 61, and that's 12 plus. And basically that's what we're seeing is kind of just a steady rise. It's not, it was very dramatic and now it's just steady. And basically we've noticed it in kind of congregate settings. Would you agree, Megan? or not necessarily?
Do you mean the cases are in congregate
Yes,
settings?
like kind of
No,
group setting, like schools and camps and stuff.
I think, no, I would say that we've had two that I can link to a cluster. Most I feel like are singles or households.
Unrelated?
No, I would say it's a complete mix.
Okay, because in the beginning it was like all over, so now it's,
Yeah, there were 3 people that were in a camp together that were positive. But other than that, it's there's 3 people in a congregate setting, but 1 is out of town, so that doesn't count for our numbers.
Okay. I'll just chime in with a couple of things. I spent some time reading about the cluster of cases in Provincetown in July, and there was a couple of disturbing things about it. The population that was infected were the 30 and 40-year-olds, and being Provincetown, it was primarily male population, which is it's not surprising. There were almost 470 cases altogether, and 74% of them were vaccinated, fully vaccinated. And prior to that, I think I had an idea that vaccination would help not only with reducing the severity of the illness and reducing deaths, hospitalizations and deaths, but it would also reduce transmission. But that shows it's not the case. And also there's been information that's come out that shows that people who are fully vaccinated still carry huge viral loads. And in fact, the viral loads that they carry are higher than, with the previous non-variant of COVID. So those things are really worrisome to me, and those are some of the things that are driving my urgency, my sense of urgency around getting people to mask up again. Right now, it's masking in Greenfield in non-municipal buildings is completely voluntary. And, in the grocery stores and so on, I see some people masking up, but I have a greater sense of urgency about this than the general population does. Not surprising given my background and so on, but I wanted to put that, just add those things at this point. Yeah, Jen.
I just have a question. And Megan and I spoke about it briefly this morning about how COVID varies from the flu. There's a new, I hear a lot of people saying, well, the flu, it's similar to the flu, it's going to be the new flu. And I think there's a difference. And Megan, when we discussed it, could you just give your oversight with that? Our opinion.
Sorry about that. I was trying to pull up the variants. Yeah, it is definitely different than the flu. So I am pretty even keel. The beginning of this, I was like, people aren't getting too sick. It's mostly the long-term care facilities. This variant is much different than what I saw last year. People are getting sicker. It's not, I don't think I've had any hospitalized long-term care people. These are people out in the community that are getting it and that are getting sick, and they're feeling a lot worse than they did last time. I had a lot of asymptomatic people last summer. I'm not having that at all. Almost, I think every single person has had symptoms. Yeah, it's much different. And I was just going to pull up the variants. I think I just did. Maybe not. All of our cases in Greenfield have been identified as a Delta variant. They've sequenced, I want to say 12 of them so far since July. They all came back as Delta, with the exception of 2 that are reported as unknown lineage. But they're not the variant that we had previously, the B117 or the P1.
I think there's a couple of things to take into consideration when we're talking about this, namely like the context of this year versus last year, which isn't to say, you know, mask one way or the other. We know masking works in terms of preventing transmission. Like there's no debate there for me anyway. But I think looking at what the activities people were doing last year at this time compared to the activities people are doing this year, it's not surprising to me that we're seeing this increase, especially with the Delta variant. And as we get an increase in vaccinated people, we're going to have an increase in vaccinated people who also have COVID. And the MMWR from Providence is definitely like, will give you it's concerning. It certainly is concerning. But it's a big case study, and it's not a great predictor of national trends. So I think that's just another thing to keep in mind as we have this discussion, and like how we contextualize mask mandates, because I do think there is a way to vaccinate our way out of this problem over time if we can continue, like as we're putting in other mitigation efforts, like continue to really encourage anybody who can get vaccinated at this point to get vaccinated, recognizing that there's a large portion of the population right now, namely folks under 12, who cannot get vaccinated. And so we need to look out for those people as well, those small people. But although COVID is certainly not the flu, and it's definitely different as we like transition into living with COVID, because I don't think anybody thinks the goal is no more COVID ever again. That ship has sailed, and we are going to have to live with COVID somehow, and vaccinated people are going to get it. And you know, some people won't be symptomatic, some people will be, but I really think we have a strong responsibility to really encourage people to continue to get vaccinated if they are able to. And I just don't want that to get lost in this discussion.
I'll just respond a little bit to that. You know, there's no question that the vaccine is very helpful. There are 2 points I'd like to make. One is that immunity wanes, and has been shown, at least in the little bits that I read, and I don't have stats on that, but even 7 to 10 weeks after completing the initial series, the antibody levels begin to wane. And so we're all going to need boosters. You know, those of us who've been vaccinated will need boosters. And if we've been vaccinated, most of us aren't going to be at all resistant to getting a booster. So that's certainly, that's a good thing. But the other thing that, you know, there's various polls taken now that the Pfizer vaccine has full FDA approval. It hasn't swayed much of anyone who was holding out. So while I think we still need to keep beating the drum about getting vaccinated, I don't have a lot of hope that we're going to get many more who are willing to do so, unfortunately. Yeah, so I just wanted to add that. Kelly, yeah, what are you seeing?
Well, actually, I just had a question about the numbers for Franklin County and the 6%. do we have any sort of indication of what the reasons for people not getting vaccinated, or, you know, has there been any, I guess, what is it access? I know we originally had the senior center set up and everything, but I know that dissipated in June, but there are other sites, correct, in the area, so it's not, they don't have access or anything like that. It's more just a personal decision. Just curious.
There's definitely vaccines available at Rite Aid, Walgreens, Pfizer. There hasn't been an uptick in people going for vaccines. There really hasn't even been an uptick in people calling about boosters. I haven't gotten, any calls. And the same with the COG, it was minimal. So there's really not much discussion about vaccine. We do get called a lot more now on testing, but not on vaccines. But I wanted to give, you mentioned the age group, Nancy, that was in Provincetown in Massachusetts. The people that have COVID, the highest age group is 20 to 29, and 30 to 39 after that. So it's still that generation of the 20 to 40-year-olds that are very resistant to getting vaccinated and that have COVID, getting COVID.
So we are, at least in my mind, considering the possibility of a mask mandate. Having, as a new Board of Health person, a mask mandate or any kind of mandate from the Board of Health is, carries a lot of weight, and I recognize that it can be overridden by the mayor. I'm aware of that. Jen, you can interrupt me. I'm not.
I just wanted to see if the board's aware of the towns surrounding us that are already having mandates or not. Is everyone aware? So around us, Amherst, Northampton, Southampton, East Hampton, Deerfield.
Northampton.
That's, yeah, north. So it's Hadley, Amherst, Northampton, Southampton, and Deerfield. The only thing I've heard in the community is it's recommended that people do wear masks inside, and that if store owners want people to wear masks in their business, they can ask people themselves to wear masks and say, we want you to wear masks. And a lot of times store owners are uncomfortable with that because there could be some belligerent people that refuse, and it puts the store owner on the spot. So there is an argument to be said that this will affect businesses or it'll affect people, but it also affects businesses and the business owner's perspective. So I've had a few calls from business owners in the community on what to do.
One thing that I was thinking about is, and I think, Megan, maybe you answered this question, is the comparison of where we are now with, the cases and the cases, the positivities, the hospitalizations. The hospitalizations, so we have 3 people in Bay State Franklin currently. One who's, no. That was that as of today?
I have one in Bay State Springfield and one in Bay State Franklin.
Oh, okay, so 2 must have been discharged. Because as of yesterday, there were, okay. Should the numbers of people in the hospital be driving this decision more than the numbers of cases that we're seeing. I see a head nod from Otis. Wondering about that. And I don't know the answer to that question, but certainly the numbers of cases as they climb are going, that's going to happen first before hospitalizations, before the numbers of serious cases go up, just by the percentage, you know. And so to me, a mask mandate now is sort of heading it off at the pass. You know, we have an opportunity to sort of get ahead of the numbers of COVID, or the numbers of the Delta variant that are going to, or I read some article, it's now the COVID 2021 instead of COVID-19. It's what we're seeing now, which is basically mostly the Delta variant and a few other smatterings of things. But I do, you know, my inclination is to get a mask mandate in place now, because I think it will help to keep the hospitalizations low. And the serious illness is low, and reduce the numbers of cases in general. Comments, thoughts, Jen?
I am confirming with Carolyn Ness. Megan brought something to my attention about Deerfield. It might just be the schools. Carolyn Ness mentioned to me that it's Deerfield. So I'm just confirming with her. So I'm trying to get an answer as we speak.
You mean whether it's just the schools or whether the town
Correct.
has a mask mandate or not?
Yeah, she told me the whole town, but I'm going to confirm that information.
We know the other ones do. I was in
Yes,
Northampton.
absolutely, 100%. Yes.
Yeah, we know the other ones have.
Yep.
You know, they're bigger population areas, you know, so understandable, but still, you know, do we want to be proactive in this regard or not? Megan?
Nancy, I think so of course vaccination is our number one tool, but I just have two things to say. One is that somebody told me an analogy about Swiss cheese, that if you have a piece of Swiss cheese that's a vaccination, I don't know where I am, there we go, and a piece of Swiss cheese that's a mask, and a piece that is,
Yeah.
eventually all the holes are going to get covered.
Yeah.
So that's one of the things that I love to show people and explain, because I think it really helps understand why you need more than just vaccination. That, of course, that's number one. It covers most of the holes, but it doesn't cover all of them. And another thing that I'm kind of noticing is a lot of people are like, how did I get this? That, you know, I was vaccinated. And they're not wearing masks. Honestly, most of the people that are vaccinated that I've talked to, my own patients, are not wearing masks, because especially around their close friends that are also vaccinated, because they think that they have this safety net. And it's not so much the case anymore that they have that, you know, really protective barrier that they thought that they had before. Of course, I'm definitely saying vaccinate, 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 but I think it's important to tell everybody that that's not 100%.
Yeah, I think
yeah,
overall, oh, sorry.
Go ahead, Alyssa.
I think overall, like not our in Greenfield, but our as like healthcare professionals and like public health folks, like messaging around how vaccines actually work and what they're intended to do has been like really poor. It's like very difficult for like lots of people to understand, you know, and certainly personally my masking habits haven't changed that much, whether there's some mandate or not. I did, sort of on a separate note, I did, in advance of this meeting, read Amherst, the town of Amherst mask mandate. And one thing that I thought was very helpful, or one thing that I liked in their statement and in their mandate, was about a continuous review of data, and using 2-week data trends to inform continuation or rescinding their mask mandate. And I think right now, you know, Nancy, you're exactly right. Like, are we basing this off of cases, or are we basing this off hospitalizations is like one key question. And then the second key question in my mind is like, how far out ahead do we get? And like, what is the downside of doing a mask mandate? It's, you know, we could brainstorm that. There's lots of things that, you know, we can think of. What's the upside? You know, it takes the heat off of business owners. It obviously prevents transmission. I feel like we're all trying to like doula our community through a transitional period here. And I don't know that, yeah, it's tough. I think we're in a really tough spot.
Kelly, I have a question for you. Are you, have the students started to return to Eagle Brook yet? I think you're muted.
Can you hear me now?
You're muted. No,
I control D.
yeah. Or the volume maybe. The volume is down to,
Sometimes I find I have to get out of the meeting and get back in order to make it work when it does
Can
this.
you hear me now?
yeah,
Yeah. Can you hear me now?
yeah.
Okay. I have no idea. I went up to the top of the screen and did it from there versus at the bottom. So so I apologize. So for Eaglebrook, we are doing it in a staged fashion. It's going to be similar to what we've done in the past. 3 days based on whether they're new, return, day student, you know, all that. And we have all of our staging, but as far in testing requirements and vaccinations and all of that. But they'll be coming in 2 weeks.
I actually have a question about contact
Time.
tracing. If someone might be able to answer that. We at the health center have had varying degrees of success with reporting our positive cases, depending on the town. When the town of Greenfield is contact tracing versus the state, like, are we looking at, I've sort of lost the connection, and so is the health center. Like, are we looking at are we also looking at vaccinated cases that are not being hospitalized? Like, there's different people are collecting different data, and I'm not sure anymore who's doing what.
So our state system, Maven, I'm not sure if you use that where you are, but you can find any information in there. So if I wanted to look up somebody by race or ethnicity, I could look them up that way. If I wanted to see all of my cases and look them up by who's vaccinated, who's not, I can do that. So any information is able to be tracked. You just have to decide what you want to pull out.
So we're only, right, okay.
So really, we
we're
track
only
it
using-
all.
Yeah. At one point, we were like reporting to individual towns, and that has seemed to not, that's like not something that's happening anymore. I think the labs are just reporting to the state.
Yes, and then we get an email, the individual Board of Health will get an email saying that there's a positive in your town, and then you call them, or you send them to the state tracing system. But they're behind by like 7,000 cases, so
Yeah.
they don't really get reached.
Thank you.
All right. Are there any more comments or thoughts about mask mandate? Okay, if not, I'm looking for, I need to have a motion so that we can, one way or the other, go forward or not. So one of my two fellow board members. Alyssa, would you like to offer that with the Amherst caveat?
Sure, I'll move to a vote. So let's see, I will move, how do I want to phrase this today? Um, have we come to before I make a motion?
Well,
have
it
we come to a
actually, the
consensus
motion,
on-
it's a little
I-
backwards. You're supposed to make the motion and then have the discussion.
Yeah, I
And
understand
if
that.
Yeah,
I'm curious if I should phrase my motion based on hospitalization numbers or based on like positive case numbers.
I don't think it can, I wouldn't suggest we include anything about case numbers or hospitalization numbers. It's simply based on what you've heard tonight. I move that Greenfield or that the Board of Health adopt a mask mandate for the city of Greenfield. Something like that. And if you're not in favor of it, then I don't see the point in you bringing up the motion. Someone has to.
I mean,
bring
I
up
could
the
move it to a vote.
Yeah.
Doesn't matter, I can move that the Board of Health
institute or
institute a mask mandate for the city of Greenfield.
okay. Do you want to include the proviso that as new data comes in, it will be reviewed and reassessed?
Yeah, I think data should be reviewed and decisions on continuation and rescinding the order should be done using 2-week data trends.
Okay.
Alyssa, I had a quick question. Can you hear me?
Yeah.
For the Amherst data that you looked at, did they go by hospitalization rate or did they go by just general positive cases?
They don't list, I didn't read like their meeting minutes and they don't list it in the announcement. But they cite an increase in cases. And I think considering their student population and the way that that town's population balloons, I think we're really different from that. But I think the way that their town's population balloons, it makes a lot of sense what they've done.
I agree. I think we should keep it sort of generic and just say something about looking at the trends, like you said. We do have a hospital here, but not obviously every city and town has hospitals or the same sort of population and congregate living and et cetera that we have. We have the jail. I mean, we have a lot of different places. So I think keeping it general and just making sure that we're keeping an eye on it and really truly evaluating it and helping it to guide our decisions.
I think another interesting thing to note from the town of Amherst is like the age groups. So they have specified the use of face masks for children between the ages of 2 and 5 is up to parental or guardian discretion. It's like a tough age group to keep masks on. And then they explicitly state that children under 2 should not wear masks. I think everyone knows that, but maybe it's worth stating explicitly. And I'm sort of, I don't have a strong opinion on the 2 to 5 age range, but I know it's something we've discussed here before, so I thought I'd throw it out to the floor.
Yeah, I think since we're in the middle of you making the motion, probably we ought to specify.
Oh, I thought we were in discussion. Sorry.
Oh, no, because you haven't seconded the
That's
motion.
true. No one seconded it.
We haven't had a second, so, we are not going strictly by Robert's rules.
That is true.
We never have. But I do think we do need to talk about age, the age range. And I would say above age 5 and something about medical conditions.
Well, I'll stop talking about it now, and I'll wait for a second on the motion. No, I guess we can resume.
Okay. We need a second for the motion. Second on the motion.
I will
Kelly?
second. I'll
You'll
second the
second it, okay. Okay, all right, so we have, we're we're in the range of going forward here and further discussion. I do think that we ought to amend the motion to include the age range and also exceptions for people with medical conditions where a mask would be inadvisable, such as a severe respiratory illness. I would ask for an amendment to include those two things. Kelly, can I get you to do that?
I didn't hear you. Are you talking to me?
Yeah,
Keeps
Kelly.
breaking up. I'm so
Yeah.
sorry. My computer keeps breaking up. Yeah, I will make a motion that we add those additional amendment changes.
Okay,
Motion.
so the age greater than age 5? I think 5 has been
Correct.
the standard, hasn't it? Yeah. And with the exceptions of medical conditions that would
Medical.
make it. Okay. Okay. We can adjust the phraseology so that it sounds good when we put it all together. Okay, so you've added an amendment. Do I have a second to the amendment to the motion?
I'll second that.
Thank you. Okay. All right, so is there further discussion? I'm actually interested, oh, Otis, are you still there? I'm interested in your thoughts, if you have any and you're willing to share.
Yeah, I'm here. There's a train going by. I hope you can hear me over the train.
Yes,
Um,
you're loud and clear, actually.
Okay, good. Yeah, thanks for letting me speak in the middle of your meeting. I'm, just one person, but I can give you my perspective more as a resident than as a counselor. So I was very cautious last year, and all the time prior to being vaccinated. I have a heart condition, and I took no chances for a long time there. And once I was vaccinated, I followed, the recommendations. And I see certainly what you were saying, Nancy, about the change in our knowledge of how easily spread it is from vaccinated people. But I worry that a mask mandate basically leaves no end in sight. And so I personally would urge you to be cautious about in voting for a mask mandate right now. I understand where you're coming from, the wanting to head things off before you get hospitalizations. But I know, speaking personally, as a somewhat younger person and a single person, that the mental health toll on continuing to exist in a pandemic under the conditions of being masked and having our social lives circumscribed is extensive. It's serious. And for me, in my personal life, I put on movie nights. Those would possibly be canceled due to this mandate. There's a lot of activities that that this will affect, and I'm not sure whether or not people will follow it. I think a lot of the people who are already masked will certainly follow it, but I worry about the people that are unvaccinated and unmasked. Will this change things? I don't know. It's a really hard decision that you all have to make, and I appreciate the gravity of it and the amount of thought that you put into it, certainly. And I respect whatever way you vote. But I did want to jump on here because, from my standpoint, I do think that vaccinated people are going to get it, and we have to come to it's a trade-off that you have to make, because I don't see an alternative unless the alternative is wearing masks forever, which it's I don't know, it's hard. So thank you for letting me share.
Thank you. I appreciate your perspective and thoughts on it. Well, I'm sitting here feeling a lot of trepidation and yeah, this is hard. I just yeah, I'm having a hard time. I'm not ready to call the question. I want more. I want more something here.
Yeah, I think we all are.
Yeah. What do we know about the town, other towns around here, like Orange? What's Orange doing?
I can tell you from the health center perspective, of working in Orange, it's a really different scene than Greenfield is, working in both towns pretty regularly. I definitely see more people masked. I mean, at work, I see everyone masked because we make everyone mask because it's a health center. But I definitely see more people masked in Greenfield and surrounding towns than I do out east. We do a lot of rapid testing in our offices, and I've definitely seen a lot more positive actually, I should say far more positive cases in that area than in Greenfield. I think we've had one positive in the past 4 weeks, where Orange has had maybe 8. So there's like a big difference there. But I think the one thing that I'm struggling with is things like mask mandates at this point seem to only reinforce like people who are cautious being cautious, and people who don't and have not taken this pandemic seriously still going in one ear and out the other. I think we're all faced with like a great deal of responsibility right now as healthcare workers, and not a lot of control, which is like a hard place for everyone to be in. And I think, you know, we've all been traumatized to some extent and are still being traumatized, and are now trying to find some equilibrium between being social human creatures that we need to be and protecting the most vulnerable among us. You know, and how do we live with that? So I think I'm inclined to look at hospitalization rates personally, because I think a lot of people are going to get this over time in the future, which is not to say it's not worth preventing and it's not worth trying to stop. It certainly is, especially with a large number of young people who still can't get vaccinated, even if they wanted to, because it's not approved for them yet. And, you know, at the same time, yeah, just a really challenging balancing act, and trying to be really thoughtful about that calculus. So that's where I'm at right now in this moment.
Yeah. So I'll just say that at this point, that I'm not ready. I'm actually not ready to call for mask mandate. And I think that I recognize that the case numbers are going up. But I also am, and I recognize that, the hospitalizations could burst on the scene. But just because of the case numbers alone is, it's not in my heart right now to vote for a mask mandate. I just have to share that with you all. I'm not there. And I may be there in a week, and I hate to have to keep calling up meetings, and I thought it was going to be tonight, but that's what my gut's telling me right now. So, other thoughts? Two board members?
The last thing I'll say is, as difficult as it is to call these meetings last minute, and I think we've all felt fatigued by that, and like everything else that comes with COVID. I think being really thoughtful about it and like weighing it, like balancing as best we can is the only thing we can do. And so, I'll meet again next week if we need to.
Thank you, I appreciate that. So we do have, Kelly, anything you want to add before I call the motion?
No,
Okay.
I have nothing else.
Okay, so we have amendments which need to be voted on first, actually. And it doesn't mean you're voting on the motion, but you're just voting to get the amendments into the motion. And then we can do one or two things, and I'll just give you a little, if we're not ready to vote on it, which I am not, we can table the motion. We can keep it active, but table it. So we're not saying no, but we're not saying yes. So just want to put that out there. But we first need to vote on the amendment, which is that the mandate would be for persons ages 5 and above, and the exceptions would be for medical conditions. So I'd like to ask for a vote on the amendments only. Kelly, Alyssa, okay, so all three of us. All right. And
I'll move to table the motion.
okay. Alyssa moves to table.
I'll second that.
And Kelly, do you second that? Okay. All right. So is there further discussion on, or is there any discussion on the move to table the motion? Okay. If, since there is no further discussion, all those in favor of tabling the motion? Okay. Okay, motion is tabled. Till next meeting, which we're not sure when that is, but we'll talk about that at the end. Deep breath. Jennifer, you ready to go on with an update on health department stuff?
Based on the time, I think it could just go to the next meeting.
Okay. Okay, that's
Regular
fine.
scheduled meeting.
That's fine. Okay, all right.
So I'd like to just
Okay,
add, as, can you hear me?
yeah,
I'd just like to add as far
some
as
of the time
scheduling
we
that
can hear
week
you.
of, I know, I'm so sorry, I have an hour. So just, I'd like to add as far as my availability, but you know, you guys do what you need to do. But that 7th, 8th, 9th, I definitely probably will not be available in the evenings. I'm just putting it out there with the students coming on
Yeah,
board. Going to
that's
be in
Labor.
evenings for the month of September. But that week in particular will be really tough for me to try and pull away. I will try, I'll do my best, but just keep that in mind.
Okay, yeah, that's Labor Day weekend, so Labor Day, right?
Labor Day, right after Labor Day, yeah, it's the week after. Labor Day
Okay, well,
is,
what about this coming Monday, which is what is it, the
30th?
30th? It's a little soon. I don't
Yeah.
anticipate, and the following is gonna be the 7th, isn't it? So maybe we
Yeah.
could meet on a different day that week.
Yeah.
Because just this coming Monday, 5 days from now, is I think, too soon to meet. But maybe the following, maybe right after Labor Day, the Wednesday after Labor Day. What is that on the calendar?
That's
That's
the
the 8th.
8th. I think that's a day
Mhm.
Kelly can't.
Yeah. I mean, I will do my very best to
Could
be
you-
available and to, but I'm the
I'm
supervisor for
sorry,
the
I'm looking
second
at
shift, so, and it's gonna be chaos.
Okay, so the 8th is a Wednesday, yes?
Yeah,
The 8th is a Wednesday.
The next scheduled meeting, though, is the 13th.
Yes, we have a scheduled meeting on the 13th. So the possibility of the 8th, if we need to do it. I mean, if the trends aren't scary, horrible, well, wait. If the trends look scary, horrible, and there's suddenly 5 people in the hospital and we've got, 50 positives, it's a different thing. But I feel comfortable in waiting a little longer to make this really, really, really hard decision. So, we have it tabled. The motion is there. It's available to us at a moment's notice to get back together and look again at the numbers. And this is hard. That's all I can say. This is, causing me stress. I'm sure it's causing all of you stress. Okay, so we don't have to plan another meeting. Do we have any other, let's see, public comments? I think we've had public comments unless there's anyone else. Here we have 2 others, Mary Byrne and RAS. Either of you have anything you'd like to say? Okay. Then, if not, a call for a motion to adjourn the meeting.
I'll move to adjourn the meeting.
Okay.
I'll second that.
Okay. Thank you very much.
Thank
We're
you.
all good. Thank you, everyone. I
Thank you,
really
Jen and
appreciate your time and, this is hard. Thanks.